Good morning, everyone, and thank you for joining us for our webinar on the COVID-19 vaccines and testing for farm workers. This morning's webinar is supported and sponsored by the UC Davis Western Center for Agricultural and Health and Safety. So we always want to give a huge thanks to them for their support in this, but also all the other endeavors that they support us in the agricultural community in. So thank you so much. Before we get started, this webinar is being recorded and it will be shared out afterwards, a little bit later today, hopefully. So if anybody has to skip out early, don't worry, we'll be sending that out so you can watch it later or also share it with others, as the more we can disseminate this information, the better. So let's jump into it. We'll do a few introductions here. As you might have noticed, we have quite a few people on our panel this morning. So we have Dr. Cora Hoover. She's a public health medical officer in the immunization branch of the California Department of Public Health. She has over 20 years experience in safety net and public health settings and is a board certified in family medicine and preventative medicine. Her work currently focuses on COVID-19 immunization and strategies to address routine immunizations during the COVID-19 pandemic. With Dr. Hoover, we also have Tomas Evangelista. He's part of the external affairs team with the Vaccinate All 58 campaign under the California Department of Public Health. Tomas has experience as a promotor helping families navigate the health systems and recently worked on the 2020 census Cuenta Conmigo outreach in Region 4. After that, we'll hear from Dr. Alexi Hack, who is a veterinarian for the California Department of Food and Agricultural Animal Health Branch and is currently working to continue foreign animal disease surveillance in the state and assist the California Department of Public Health with outreach on COVID-19 testing to agricultural communities. And we'll also hear from Supervisor Alfredo Pedrosa, who is the Napa County District 4 Supervisor, appointed in 2014 and winning election in both 2016 and 2020. Prior to joining the Board of Supervisors, he was elected to the Napa City Council in 2012, becoming the youngest and first Latino council member ever elected. Professionally, Alfredo has worked in the financial services industry for more than 10 years, and he comes from a family of farm workers. And we'll finish up with Erica Rosasco, who's a partner at McCaig Rosasco LLP in Roseville, California. She represents employers, agricultural employers, farm labor contractors, businesses, nonprofits, and insurance carriers in all aspects of employment and civil litigation. And she has experience with jury trials, bench trials, mediations, and arbitrations. Once we hear from everyone, we've of course set aside a good amount of time for questions at the end. So please, throughout the webinar, use that Q&A function at the bottom of your screen to send in your questions. And with that, let's kick it off with Dr. Hoover, if you'd like to share your screen.
Okay, give me just a sec here.
Looks great, Dr. Hoover.
Great, thank you. Good morning, everyone. I'm so pleased to have a chance to speak with you today about COVID-19 vaccines. We're going to go through, excuse me, I'm just going to advance my slides. We're going to go through the impact of COVID-19 disease, some information about the vaccine products, about COVID-19 vaccine efficacy and safety, and a few frequently asked questions. And then I'm sure there may be additional questions which we can address at the end of the webinar. So I don't think I need to emphasize this too much because this is very deep in everyone's awareness right now of the incalculable impact of the pandemic worldwide, in the United States, in our state and locally. I'm sure it has affected many on this call in personal ways as well. To finally have vaccines available against COVID-19 is incredibly exciting, and it's really, as I said, a privilege to be able to speak with you about this. You also may be aware of some of the disparities related to COVID-19 cases and deaths in California. And this just looks at cases and deaths by ethnicity. What you see is that Latino individuals really have been disproportionately affected by COVID-19 in our state. I'm going to shift now and talk a little bit about how mRNA vaccines work. mRNA is the type of vaccine that's currently on the market. Some of you may have heard them referred to as the Pfizer and Moderna vaccines. And can expect that there will likely be additional vaccines that have different characteristics being introduced in the coming weeks and months. And so please stay tuned for updates regarding these newer products as they come online. So mRNA vaccines involve receiving a piece of something called mRNA, which is a genetic material that's used to create proteins. And your body uses the mRNA to manufacture something that's called the spike protein. This is a protein that's found on the surface of the virus. It's kind of a signature protein on the outside of the virus particle. And this spike protein is recognized by your immune system and creates an immune response. And so this immune response teaches your body to recognize and respond to the virus. So then in the future, if you're exposed to the virus, your immune system will quickly recognize the spike protein and begin attacking and destroying the virus. And the goal of this is for all of that to happen before you get sick and to prevent illness and infection. The mRNA vaccines are highly effective at preventing COVID-19. They're up to 95% effective, and they're similarly protective across age, gender, and race ethnicity. So they've been tested in a range of populations, and this efficacy really is seen across different groups. And not only did they prevent COVID-19, but specifically they reduced the risk of severe disease. However, we are still in the process of understanding even more about the effects of the vaccines. Some of the specific questions are, will the vaccines prevent vaccinated people from spreading the virus to others? And also, how long will the protection last? So some people have questions about the fact that the COVID-19 vaccine was developed so quickly, and also questions about safety of the vaccine. So the vaccine was developed quickly. However, it built on a lot of previous knowledge and research that's been going on for nearly 20 years. And another key point is that mRNA vaccines are much faster to produce than traditional vaccines, which is one of the reasons why these mRNA vaccines were the first on the market. The other reason that the vaccines were able to be developed so quickly is that there was a really massive financial investment in the development process. So there weren't those barriers that usually exist in the process of vaccine development. They were able to get things running and conduct their trials very, very quickly. But with all that said, despite the speed with which the vaccines were developed, they met the same safety standards as all vaccines. This includes vaccine trials, FDA approval. They received EUA or emergency use authorization, CDC safety monitoring, which is ongoing, as well as independent safety monitoring. And existing and new systems will continue to monitor safety on an ongoing basis as more vaccines are given. And these are a couple of the main systems. One is a vaccine adverse event reporting system, which is open to all medical providers and vaccine recipients to report into. As well as a cell phone app called vSafe, which is an after vaccination health checker, which everyone who receives vaccination should be encouraged to enroll in. And it will periodically contact you by text to ask you to report how you're doing after vaccination. Okay, What are some of the side effects of COVID-19 vaccine? So there can be some local and systemic side effects. These might include pain, redness, and swelling at the site of vaccination, basically a sore arm. Many people have experienced this after a flu vaccine, for example. It's usually not a big deal. There can be some systemic side effects. These may include fatigue, headache, fever or chills. These side effects tend to be more common after the second dose. Both the vaccine products currently being given do involve 2 doses. Most side effects are mild to moderate in severity, occur in the first several days after vaccination, and get better very quickly. They're not harmful. They're actually a sign that your immune system is kicking into gear. It's fine not if you don't have side effects, but if you do, they're not a sign of anything harmful. However, there are some symptoms that aren't due to the vaccination. And if you have them, you should still be thinking about the possibility of COVID-19. These would include cough and shortness of breath and some other respiratory symptoms. So a few of what we might think of as frequently asked questions about the COVID-19 vaccine. The first is, can COVID-19 vaccines give me COVID-19? The answer is no. None of the COVID-19 vaccines in use or under development use the live virus that causes COVID-19. As we just discussed, people can experience normal side effects after vaccination, which are signs that the body's building immunity, but don't mean that you have COVID-19. It can take a few weeks for the body to build immunity after vaccination. Or excuse me, it takes a few weeks for the body to build immunity after vaccination. So if someone is exposed and infected right around the time they're immunized, they still could get sick because the vaccine hasn't had enough time to provide protection. If I've had COVID-19 in the past, can I get vaccinated? The answer is yes. People who've had COVID-19 may still benefit from vaccination. This is because a person may become infected with the virus more than once, or because of concerns that a person may become infected with the virus more than once. It's recommended that you wait until you've recovered from your acute illness and are no longer under isolation before getting vaccinated. Can the COVID-19 vaccine make me test positive on COVID-19 viral tests? No. Vaccines currently authorized for use or in development won't cause you to test positive on viral tests. Viral tests are used to see if you have a current infection. After you've been vaccinated, there is a possibility you might test positive on antibody tests, which show previous infection. And the development of antibodies against COVID-19. I think I won't go into that in any more detail, but just to say that the viral tests that are usually used to test for current infection are not affected by receiving the vaccine. Will I still need to take precautions after getting vaccinated? Yes, we need to continue taking precautions while we learn more about these vaccines. For one thing, certain age groups still can't get vaccinated. While vaccines are in short supply, we need to continue to protect others. And we're still learning about all of the effects and benefits of the vaccines. Here are a few links to resources that will be available. There are some very good educational materials available both from CDC and from the state of California that are linked here. And that concludes my presentation. I'm going to stop sharing my screen now. And
Dr. Huber. Yeah, let's bring up Tomas Evangelista. You are muted, so remember to unmute, please.
Of course, thank you so much. I'm going to share my screen, so give me one moment.
Looks good, Tomas.
Okay. Thank you so much. Thank you to the California Farm Labor Contractor Association for the opportunity to present in front of all of you. My name is Tomas Evangelista, and I'm a new member of the External Affairs team with the Vaccinate All 58 campaign under CDPH. This is only my second week at CDPH, and in my short time, I've reached out to some of the organizations working with the farm worker community and have gathered important data to help identify the most effective messaging to farm workers. But before I continue, I want to thank Dr. Hoover for her wonderful presentation. There's always a few things that I learn every time I see a presentation, and it's important that we continue sharing some of this information. So let's see. So the goal of our messaging is to educate, motivate, and activate Californians to get vaccinated when it's their turn. The audience, of course, is the disproportionate impacted Californians, and in this case, the farm worker community. And one of the first key messages that we want to ensure that our farm workers are getting is to provide basic vaccine facts, similar to what Dr. Hoover was going over. We found that when people are given some of this information, that they're able to that they feel much more comfortable taking the vaccine, but it's very important to also give it in not only written form, but also verbally and in Spanish or other spoken language by workers. There's some workers that, of course, have a lower education level, and sometimes when they're given a piece of paper, they usually won't be able to read. And I think providing some of this information verbally at your work site would definitely reduce some of this vaccine hesitancy. Also, I think it's very important to provide an opportunity for some questions and for some questions that people may have at work. Of course, some of these questions may be answered when they're getting the vaccine, but sometimes that might not be the case. So if there's an opportunity for people to get some questions answered, that's also very important. Um, and when we're talking about providing some basic vaccine facts, of course, this goes together with a safety message. It's also important to let them know that the vaccine's safe, but it also won't impact some of their immigration status. Of course, there's a lack of health insurance to some of the workers, and some of them may not be familiar with some of the receiving any health care. So sorry, I think I got too ahead of myself. One other important message would be addressing barriers like lack of access and vaccine hesitancy. Of course, the vaccine is free. It doesn't require health care. And it's important to note that in a study of farm workers by the COVID-19 farm worker, 58% were uninsured, and a study by UFW found that 78% were uninsured. Also, I think it's important to note that that there might be some hesitancy to take the vaccine because of a lack of sick paid leave, and some of the side effects could concern some of the workers, since if the side effects keep them out of work, that they would be concerned of losing their job. So some of these strategies, like I mentioned, would be providing COVID-19 basic vaccine information, but also communication efforts with a culture humility, also community engagement through trusted messengers, which I will go over in a few moments. Communication with culture humility includes in language, providing this information in language, addressing vaccine hesitancy, combat mis and disinformation, engage in trusted messengers, focus on ethnic media, and also on fully integrated and coordinated with the human community outreach efforts. So some of this information might, of course, will be picked up outside of the workplace. California is working with trusted messengers throughout the state. So there'll be 150 community-based organizations providing information to communities. And it's important to link up with one of these CBOs and make sure that they're providing information to the workers on the ground. And I want to share a few of our stakeholder interviews. We interviewed 15 CVAC members, and some of this information was very important to share. For example, focusing on how the vaccine helps family and community, also acknowledging the distrust in government. And here are some other feedback that we received of barriers to accepting the vaccine. And to finish off, we provide a toolkit for partners where you can go on there and print out some flyers so that you can provide to the farm workers. And also, we're very interested in your feedback. So, and also here's an email where you guys can get a hold of us and provide some of that feedback. Thank you.
Tomas, before we transfer, could you actually go back to that slide about the common hesitancies or concerns that people have? And then Rachel, we will share that last slide with the contact. So we have a couple more minutes in this little section, so I wanted to see if you had any specific comments about this, about these concerns, and how you can make them feel better, make them more feel more open to getting vaccinated.
Yeah, of course. Well, one important one here that we see, fear of deportation. Of course, the vaccine outreach doesn't impact immigration status, and I think it's very important to state that, just because some people, since of course this is free, might feel like there will be some impacts with like public charge, but that's not the case. And I think it's important to make sure that we say that, so that people are able to feel safe going to go get a vaccine.
I've also heard concerns in that same area about the identification they need to get the vaccine.
Right. Yes. And that's something that's being worked on right now, and I think it's we will address soon.
Dr. Hoover, like I said, we've got a couple more minutes here. Is there anything on this that you would like to address as far as these concerns that people have?
So one that I might comment on is the perception that herd immunity is better than the vaccine. So this is a little bit of a tricky concept, but I think the idea is that folks might feel it's better to just get COVID and get it over with rather than getting vaccinated, because if I get COVID, I know I'll be immune. And I think that the issue here really is that COVID can be a deadly illness, and it's a pretty risky way to go if you have the option of having a safe and effective vaccine instead. It's a lot safer, and it's a lot better way to get to what we call herd immunity or community immunity through vaccination rather than through most people getting infected. So really, definitely the vaccination is preferred, and it is safer.
Excellent. Thank you both so much. Tomas, if you'd like to put up that last slide with the contact information again, we'll hold it for just a second. And then just to reiterate, we will be sending out a copy of this presentation once it processes it at the end, so you can go back to any of it. All right. Thank you so much, Dr. Hoover and Tomas. With that, we're going to move on to Dr. Hack, if you'd like to share your presentation and come on up.
Of course. Can you hear me all right?
Yes.
Excellent. Well, thank you all for joining. So my presentation will discuss the Valencia branch lab and COVID-19 testing resources that you as a business or a farm worker can access and use on site as needed. So just a little background, the Valencia branch laboratory opened in November with a goal of really ramping up testing capacity within California. We can do up to 150,000 tests a day, and we are not yet near that capacity, so we're still looking to grow. The three other pillars are really equity, access, and cost sustainability. So we're really trying to look for vulnerable and at-risk populations who might not otherwise be served by testing centers throughout the state. This could be rural areas that just don't have local clinics they can attend to get tested, or even in urban areas where if a packing house kind of had an outbreak situation, they would overwhelm local resources, and it would really be more beneficial to the community if they could have testing on site at any time they needed. So we're really looking at community clinics, hospitals, places of worship, congregate living settings, schools and universities, and in particular, medium contact workers such as agricultural workers and those involved in food processing. Overall, for cost sustainability, while these tests are not charged for directly to any individual or company, they are some of the least expensive tests out there right now. And the greatest thing about these tests is that they're the anterior nasal swabs, which can be self-ministered. So this isn't the one that goes all the way to the back of the nose. It can be painful. This one is just about an inch in with some twisting, and then the other nostril. It can be done by anyone, and it can be observed by anyone. You do not have to be a medical professional to observe these kits being administered. So each organization does have some responsibilities that they have to take on, and the state takes on responsibilities to help get this stuff to you. So we provide the test kits and the test processing. As appropriate, we will recoup costs through a third-party biller. So the state's not involved in that, and it is going to go through insurance, and except for some rare occasions where a business might choose to have direct billing for themselves. So we'll process the samples and return results within a 24 to 48-hour turnaround time. This is really important, especially for ag communities when they're trying to get the produce processed, get it through, and they need to make plans for what their workforce is going to look like over the next couple days. We also offer detailed support and instructions for operating test site. I'm available for any ag community who's looking to set up a testing center at their work site or nearby so that they can get their workers tested. We also use color as our patient registration system and for test reporting and results. And these test results go directly to the individual, either through text or email. We understand that that might not always be effective for communities who don't have access to internet or a cell phone. So there are alternative ways to get information out. And we can discuss that in a little bit. And just to say, the state does not have access to the color information. So if an individual puts their information on to the color system, such as their name, their birth date, the state doesn't have access to that. It's held in a third-party color system. So for the organization responsibilities, we really just want to know what you're hoping to do. Are you going to be interested in testing for asymptomatic individuals, which is kind of a more regular testing system? Or are you kind of hoping just to set up for an outbreak situation? We really recommend kind of more regular testing to look for asymptomatic individuals because that can really help prevent outbreak situations in the future. You will have to procure your own PPE. There are state resources for this that we can put you in touch with, and you'll need to provide physical space. The PPE required you likely already have on site: gloves, a face mask, potentially a face shield or some barrier between you and between the person observing the test and the person administering the test to themselves. If you are interested in setting up a community event, we really recommend driving outreach participation just to make sure that you can test as many in the community as possible. However, you are not required to have it be open to the community. You can keep it solely within your business. In addition, you will have to provide staff and manage on-site logistics. This requires a computer or a tablet and a barcode scanner, which is generally the only purchase you will have to make originally, which is about $20 to $25 online. For providing staff, one person can input about 100 people in a day for the patient registration. If patients already have access to internet at their home, they can sign themselves up, and then the staff member really just has to observe the sample collection. And we do provide videos to really observe the sample collection and how to do it. Like I said before, it does not have to be a medical professional. Anyone can be trained to be able to do this observation. Finally, the organization is going to be responsible for packaging, coordinating, and shipping the samples back to the lab. And I'll discuss the cost of that in a little bit. So just a general idea, you can be up and ready to go testing at your work site in as little as 2 weeks. In the beginning, we just need an interest form. Let us know how things are going at your site, what you need, how many people you're hoping to test per week or every 2 weeks. Filling out the onboarding form and completing the agreement form. And then we approve any ag community who's interested in doing this, and we're going to work to make this work for you. If you have concerns or questions, I'll be here to answer them. And we have other state partners if you're not an ag group who can help you. And so once you get approved and are signed up, it's really just preparing, arrange shipping, procure your PPE, train your staff, provide the space, register with color, make sure you feel comfortable with that. I've heard from all the sites we've already set up that that is one of the easiest things. It's an online system. You click, you enter patient information, name, date, any COVID symptom information, and then you move on. Procuring the tests and kits and the shipping materials is very straightforward. It takes about 2 to 5 days for them to arrive. And so once you have access, you can order them right away and as needed. Then you just register your patients for testing and you supervise a sample collection and you ship them back. And within 24 to 48 hours after you receive them, you get results back. And they're either texted or emailed to the individual. And in certain cases, we can allow an HR representative or a business manager to have access to those results with HIPAA compliance and permission from the people being sampled so that you can make department decisions and all that. And so I just want to talk a little bit more about the billing because this is often the biggest question. So most everyone falls into the first option, insurance billing. A third party will bill individual insurance for the $55 per test. And this is really just to recoup costs only for the test kit and processing. We do not make any money off of this. If the individual is unable to provide insurance information at the time of registration, they will not be billed. The state takes on that cost. So someone who's uninsured can still get tested. And so the second option, which is rare but does occasionally happen, the state can bill directly to an organization. This might happen if an organization is self-insured, such as that their insurance premiums may go up in the future if they were to be insurance billed, so they'd rather pay upfront directly. And like I said, the $55 per test is at a much better rate than a lot of other testing groups right now are doing. And then just to discuss briefly, getting the kits back to the lab. So we understand that it can be very expensive to have a private courier to have them shipped back. And so some people already have that arrangement made and it's not that much of an additional cost to have those kits shipped back. So they choose the organization owned, they ship back. However, if you are struggling with kind of figuring out how you're going to get stuff shipped back, when you sign up, you can join the CCN, the COVID-19 Courier Network. It's a statewide network of drop boxes. They're generally set up within 60 minutes of each test site. If there's not one near you, we will work to try to get one near you. And the samples are shipped a little bit differently depending on which option you choose, either a box if they're going through a FedEx or a USPS courier, and then in a biohazard bag if they're sent through the CCN. And anyone can be able to package these for shipping, and we will provide training to do that. Both options have about the same transit time. Generally, you choose the overnight and it's there within the same day. And the state network is free. I forgot to say that in the beginning. You do not have to pay to utilize it. You just have to let us know what your needs are. And so I will be sending out a flyer after this to all of you with the links provided here and my contact information. But to express interest, it's a quick form, about 13 questions. And then we also have a detailed playbook with lots of information, very specifically about how do I do this or how do I do that. And it provides a lot of the material we would use for training for both testing and shipping.
All right, Dr. Hack, thank you. Most of the questions we are going to be holding to the end, but as we have a couple minutes here in this section, I did want to address a couple questions that we had just specifically on the testing. Is it available outside of the state of California?
Unfortunately, no, this is solely for Californians within California. So anybody visiting can access it, but we cannot export these kits outside of California, and we cannot receive testing kits from other states to this lab.
Okay. Do you have any resources you might point them towards in their own states?
If they're really interested, or if they have kind of some California-based operations and some outside, have them send in an interest form, and we kind of work with them to see. We work with Color, and Color does have some private arrangements with other companies who are across the border to kind of be able to access a similar system, though it does not utilize the Valencia branch lab.
Excellent, thank you. And one more right before we bring up the Supervisor Pedrosa, is the patient registration available via a mobile app as well?
So it is not available on the phone. Just with how it kind of scales down, it does not look great on an iPhone or an Android or anything. However, any tablet or computer can access it. And then that's different.
Oh, please go ahead.
Yeah, that's different from messaging results. The results can be viewed on a cell phone.
Excellent. So please keep sending in your questions to that Q&A. Most of them we will be holding to the end. And with that, thank you so much, Dr. Hack. We're going to bring up Supervisor Pedrosa.
Good morning, Kimberly, and thank you to everyone that's participating, especially all the FLCs that are on the call. It's really great to be here and provide some local perspectives of what we're seeing in Napa County in terms of trying to reach our ag community. And I'm going to focus on two things today. I'm going to talk a little bit about testing, and I'm also going to talk a little bit about vaccines, and then also just some opportunities to really make some meaningful change. And what are the two areas I think we should be focusing on? So in terms of testing, I think what has helped in Napa County was really talking about those CBOs, those community-based organizations. I think one of the previous speakers talked about the trusted messenger, and I can't emphasize enough the importance of that, especially in trying to reach our farm working community that tends to be Latino. So what we have done that worked well in terms of reaching our ag community from a testing perspective was being able to work with our ag commissioner, and those are found in every county predominantly. So that is a great partner for FLCs and ag-based communities or organizations. We also worked with the local farm bureau. And what we did was trying to go to them. You know, we all know some of the challenges in terms of, and it was also mentioned by some of the speakers, of many members in our ag community don't trust government. And you can't expect them to go to government services or government institutions. So in a pandemic, I think you really have to think out of the box. So some of the things we did, and I was personally involved, is we went to vineyards. We coordinated with our Farm Bureau of identifying who were the biggest FLCs in our community. And we went to the vineyards, socially distanced, and we provided them some information of breaking some of the myths, addressing the questions, addressing assumptions that were made that were covered by some of the speakers before. But when you go to them, it really humanized this. It really brought extra attention to the matter of getting tested and explaining why it matters and why herd immunity is not the solution. So again, going to them, going to the vineyards, doing that type of advocacy, working with the ag commissioner and ag-based organizations, I think was really successful. And it also helps when you're elected officials who aren't bilingual. And there's quite a bit of supervisors out there in the 58 counties that are bilingual. They're a partner, and they bring the government perspective to it, but it creates some accountability and ownership among the elected official of being invested in seeing our community get tested, but also from the receiver of the message of our ag community saying, wow, we do have an elected official here that's talking about this. And what we also did is we used, many different social media platforms to provide information, because one of the things that was important, I can relate, having parents that never learned English, was I didn't want folks to be dependent on someone to get the information. So how did we convey the message in a way that they could understand, or they weren't dependent on their neighbor, or they weren't depending on someone translating it for them? They were able to get that message directly. So we've been doing a lot of social media videos once a week from the County of Napa platform on social media on Facebook. We do a video, at 4 p.m. in English, at 5 p.m. in Spanish, predictable. And what was really interesting is it created an opportunity to engage with the community, answer questions through social media. And we were talking about this earlier with the panelists. We had over, some videos were viewed over 20,000 times by members of our community. And Napa County is a community of 140,000 people. They were viewed 5 times more than the English videos. And that was really important because it showed the need and the thirst for information. So how did we provide information in a way that they could get that information in a way that was comfortable? And we also saw it as an opportunity to encourage them to share it. So again, when we were out there in the vineyards, we asked folks, take out your cell phone, go to the county webpage, look at this video. So again, it was really empowering them with information, understanding of the importance of getting tested, addressing the concerns of, if I don't have legal status, what does that mean? But it also covered the need of making sure that at some of these testing sites, we had people that were bilingual. We had people that could answer the questions in Spanish if they went to a test site. So that was really helpful. And I think it did attribute to Napa County having a good enrollment and participation among our ag community, again, assuming predominantly that they're Latino. So we did have a good success rate in that. And again, using those different platforms like social media to provide an ongoing, consistent way of getting messaging, because we know, especially in communities like California, one of the hardest part government struggles with is how do you communicate with those hard to reach communities? And when you create that dependable, reliable system, it really was something that people embraced. Now, shifting to vaccines, which is what we think about, virtually every day. I appreciate our state partners that have tried to be a good partner to local counties, but it has been frustrating because we're the first line of public service. They don't get to see who CDPH is. They get to see who their local supervisors are, because this is a county response. So the good news is our ag community is part of 1B, phase 1, which was very important to us, recognizing that our ag workers have been essential from day one. So I commend the state for including them in that priority list. Now, it has changed. That tier has expanded. And the number one issue that all counties are facing is inventory shortage. So it's been frustrating at the local level when the tiers get to expand, where they become more, when more folks are eligible. And we typically would be very supportive of those efforts because we want everyone to get vaccinated. But when the inventory is not there, local counties are having to follow these guidelines of picking winners and losers. And we don't want to do that with vaccines. Someone that's 65 plus is equally as valuable as a farm worker. But when you're having an inventory shortage, it's really hard to prioritize because the state has provided these very broad-based guidelines. But again, the good news and what we should commend the state on is that farm workers were eligible and are eligible in 1B. What we've done around the vaccines, again, is very similar to what we did with testing, which is bilingual communication, ensuring that people were informed, ensuring that our trusted messengers, like the community-based organizations, we also went to churches, and also the ag, the farm bureaus, any wine ag group associations, ensuring that they were communicating with the FLCs. What I've learned in all this is FLCs, who predominantly on this call, are so important right now, because one of the things that we have seen in Napa County, of all the 40,000 vaccines that we've administered, which is roughly over 28% of Napa County's population, 12.1% of those have gone into Latinos. And again, let's just assume that's agriculture workers. One of the things that we have been able to work with is these healthcare partners. So when the state is providing vaccines to a local county, the counties are getting an allocation, but also MCEs, which are multi-county entities like hospitals, and an example in Napa, what we've done is we've been working with the local hospitals where they get a specific allocation of vaccines. They're staying within the eligible tiers of 1B. But when we didn't have the infrastructure from the state, we created our own systems to vaccinate our community. We created sign-up lists where our community can go and expressively express an interest to get vaccinated. But what we saw was that our interest form, which was someone willingly going to the county webpage and saying, I'm interested in the vaccine, did not reflect the demographics of our community, in particular our Latino community. So working with multi-county entities like the hospitals, we were able to reach out to some FLCs and we worked with them and said, look, you have that direct relationship with your employees who are ag community, who are eligible. We cannot expect, for those that do go sign up, we commend them. But for those that are not signing up into the county interest form, which is our way of sorting and organizing who is getting vaccinated, we need to work with you as the employer to coordinate and to organize the vaccination clinics. So an example, we worked with one of Napa County's biggest farm labor contractor, and we had 200 employees go to a clinic organized by St. Helena Hospital. And they were able to vaccinate over 200 ag workers. And that was a success story. That wouldn't have happened had we just expected people to go to the county list and we were calling people as they became eligible. It was done in a coordinated way. And I think that's the value of FLCs is you can work with your employees, you can address those fears, concerns they may have. But it also creates some peer-to-peer responsibility of saying, look, we're in it together. We're essential. We should get vaccinated. And that's really attributed to the success in Napa County. So again, it was working with those FLCs, working with the ag organizations, where they were able to, as a group, as an employer, go to these vaccination clinics in an organized way that allowed us to have the success and reach communities. What we also did is we made resources available for those FLCs that wanted some support from the county, from public health. We made resources available where we would go to them, again, create meetings that are socially distanced, all the right PPE equipment being worn, and we address the questions that people may had. That was a barrier to getting vaccinated. So again, those are some of the success stories that we can point to at the local level that are attributed to some of the early successes that Napa County have. It's not specific to Napa County, but the formula is there and it can exist in any county. It's just having the right participants at the table to create these strategies that engage our ag community. Now, going forward, well, we do see some challenges, with the state turning to my turn. I think it's a system that in the long term will make sense, but it is going to be potentially a little bit harder because now it's going to limit our ability to work with FLCs to create these group-like vaccination settings where people are now going to have to enroll into the online portal of My Turn, which again, from a state perspective, it's the right thing to do to bring some organization statewide. But we do fear that our ag community may not be as willing to go proactively sign up on a form, which looks like government, feels like government, and it might limit our ability to do some of these different type of strategies where we're working more directly with the FLC. So we continue to advocate with the state in terms of looking at the strategies that work at the local level, because we're all united here. And the reason we're all on this call is because we want to make sure that our community gets vaccinated, especially our farm worker community. So we need to acknowledge that sometimes a one-size-fits-all approach isn't the best. And we don't want our Latino community, the outcomes that we all want to avoid is where our Latino community, our ag workers are last to get vaccinated because the system weren't really encouraging our ag community to get vaccinated. So what I would ask everyone on this call as an FLC is you're part of the solution. I think reaching out to your local electeds is part of that call to action. They can be very supportive of working with those local ag organizations, working with the local public health, ensuring that they're advocating to the state of what works for our ag community. So again, there's 58 counties, there's 5 supervisors in every county. they're a resource, and that's our job, to roll up our sleeves in moments like this to help and be part of the solution and bring a perspective that might not normally be there. The second kind of call to action, and again, we have folks from CDPH here, and their presentations clearly demonstrate that they understand the challenges we face, is how do we work with them? How do we provide them information? So that way, as they're making decisions at the state level, they're taking into account some of the challenges we see at the local level, because we're the ones implementing. We're the first layer of feedback we get. So we need to make sure we're advocating at the state level with CDPH, so that way they know that as they make changes to the system, and we all acknowledge that we've never seen a pandemic in our lifetime like this. So we will make mistakes, but once we make mistakes, we have to address them. But we need to give the state the opportunity to make those changes for the better, to ensure that our farm worker community is not being left behind, that they're front and center, not just through symbolism and words, but through real ways that we could actually vaccinate and reach our community. Those are the results that we're striving for. And the state is trying to be more transparent with some of the data dashboards that they're presenting and showing who is getting vaccinated. So, Kimberly, those are some of the things we've seen at the local level. We still have a long ways to go. This is the first phase of a long journey we're on. But I really encourage all the FLCs that are on here, is you play such an important role in working with the local elected officials, working with organizations like this association, and bringing such a valuable perspective. And that needs to be shared. That needs to be shared up the ladder of government, but also down the ladder of government to your local elected. So again, Kimberly, thank you for the opportunity to join you all. I'm going to try to stay around for questions at the end as well. But again, I really appreciate everyone's desire to reach our farm worker community and ensure that they have equal access to receive a vaccine, because we all know they've been essential from day one.
Thank you so much, Supervisor Pedrosa. There's been some questions streaming in, and we'll get to those in a minute. Please keep sending them on in. But for right now, we're going to pass it over to Erica Rosasco.
Good morning. Can you hear me okay?
Yep, everything looks good.
All right, good. Let me share really just more of an outline this morning than anything else. To bring up some of the legal issues that you have if you're considering vaccination. First, we have to give our disclaimer, right? The stuff on vaccinations, I will tell you, literally changes quite frequently. And so you definitely want to keep reviewing your newsletters that come in. California Farm Labor Contractors does an amazing job setting out new rules and things that come about. So keep your eyes and ears open for that, because it does change. If you have any specific questions to your organization, make sure you contact your legal counsel. So the first thing in considering vaccinations is, are we going to make this mandatory, or are we just going to encourage our workers to get vaccinated? And it's a very tough decision for employers, and we don't have the clarity that we would like at this point in time to say which way we can clearly go. It's also probably a little premature at this point to say you're going to make it mandatory, because we don't have the vaccination supply necessarily available to do that for everyone. Even though ag has been prioritized, as we know, it's not necessarily available statewide just yet. So if you're going to consider making it mandatory, something you have to ask yourself is COVID-19 a direct threat to the health or safety of other employees? And that is a workplace by workplace decision, and it won't necessarily be the same answer for your entire organization. So if you have a packing house and people are very close together, that's an easy yes. We know we've seen big outbreaks in packing houses and in settings where people are working really closely together. I'm sure everyone's seen some of the headlines on that, right? So that's an easy yes. But if you have a remote worker or an office worker or somebody who's off working by themselves, that might not be the case. So it's not, all of our settings are not equal. So that's one thing to consider. are you going to make it mandatory for everybody, or are you going to slice it up depending on your workplace, right? So look at each setting before you consider making it mandatory if you want to look at that down the road. At this point, most of us are just going to encourage, right? The EEOC has said yes, so they're our federal agency, Equal Employment Opportunity Commission. They're our federal agency to California's DFEH, Department of Fair Employment and Housing. They have said yes to mandatory vaccinations, but of course, California has been silent on the subject. And as everybody knows who operates a business in California, we're a much different beast than the rest of the nation. And so we have ADA considerations, right, that we have to take into account if we were going to make it mandatory. And in addition to that, right before our administration changed federally, there was a rule introduced that said if you're going to have a wellness program, and they would consider mandatory vaccines in-house taking place at the workplace to be a wellness program, that could run afoul of ADA laws and GINA, the genetic information that we almost never talk about. And that if you were going to have a wellness program, you could only give an incentive of modest value. And they gave an example of a water bottle or a gift card of modest value. Now, what's modest to you may be different than what's modest to me, right? So we didn't get an exact number on that. That rule was, of course, like almost everything, put on hold by the Biden administration because they wanted to review what the previous administration was doing before they continued with that. So it does look like if you said, okay, we are going to get our workplace vaccinated, but you're going to be able to go and get your vaccination wherever you like, that you wouldn't implicate these wellness rules. So if you just said, hey, look, we're going to pay a bonus to people who go and get a vaccine and show proof of vaccination, that shouldn't be shouldn't be capturing that wellness program issue. So we know this wellness program rule is in flux. And so that's another one that we've got to sort of stay tuned for in the future because it might change. And we are hoping, because everyone is encouraging vaccinations and wants the vaccinations to get done, and we want to give as many incentives as possible, that there would be a relaxing of those standards for the COVID vaccination. If you're going to make it required, remember that you've got to pay your employees time and mileage. So wherever they have to go, and I say mileage or the cost of public transportation, right, a bus ticket. For most of us in ag, it's always going to be mileage. That time could end up being overtime, right? So you've got to consider that. If you are paying a bonus to get a vaccination, then you have to, that's a non-discretionary bonus. You do X, you get Y. That means that bonus has to go into overtime for that work week. So if you're going to pay a set bonus, and it's a flat sum bonus, so we calculate those a little bit differently than regular bonuses. So it's not calculated the same way you would general overtime. Instead of dividing it by the number of hours you worked, you would divide it by your regular hours. So most of us, that's 40 hours. And then if your wage order 14, you divide it by 45 hours to get your rate. So flat sum bonus is implicated there if you're going to say, okay, I'm going to give a bonus to get a vaccination. Most employers surveyed were looking at $100 or less, and employees did find that to be, nice, but there wasn't any real data to say whether incentivizing it was going to change anybody's mind about getting the vaccination, right? So it's a balance there of how much do I offer to get you to take the vaccine that you might not otherwise get. Some other types of bonuses that people are looking at doing is saying, okay, I'm going to give you, an extra day of PTO. If you have a paid time off program, I'm going to give you 4 hours of pay and mileage. So you give a blanket of time because then they know, hey, look, if I set up an appointment and I'm in and out in 15 minutes and I get 4 hours of paid time off, that's pretty incentivizing, right? Everybody wants free time off to do nothing, right? Every now and then. So that's another option. But again, remember that's going to be counted towards your time worked. So look at when you're doing that. And, ideally we would do it during the times that we're not working overtime. If you're going to make it mandatory, well, and even if you don't make it mandatory and you offer an incentive, you've got to consider the ADA, your disabilities, and your religious considerations. So if somebody says, time out, I can't get this vaccination because I have a disability that doesn't allow me to, or I have a sincerely held religious belief, you're going to have to stop and engage that person in the interactive process. So that means we're having a discussion, right, about whether or not they can get the vaccine. If they say they've got a disability, you can give them a certification form to have their doctor fill that out to say what it is, or you get a note from their doctor that says they can't receive the vaccine. You don't want to know what the disability is. You don't inquire into it any more than you absolutely need to in California. Outside of California, different. But in California, we don't ask, well, what is it that you have? No, we just have to get it doctor supported that they cannot get the vaccine. If it's a religious reason why, then you can ask for some more information. What religion are you? And I always tell people when you get into religion, it gets a little, unless you're just going to stop there, but if you want to really dig into it, it's definitely the time to call your attorney, because there are some things we can sort of dig into and do a little research to determine, does that religion have this belief or is it bogus? And so we can get a little bit of information from them on that religious belief. And if you think it's bogus and you want to dig into it more, definitely call your attorney, because there are some things we can tread carefully to do. Now, like all things in HR, if you didn't document it, it didn't exist. So you want to document your interactive process with your employee to say that, yes, we discussed the ADA reason, the disability, or we discussed the religious reason. But if you're offering incentives to employees to go get that vaccination, what do you do with an employee who has a disability or a religious belief that they can't get the vaccination? So it does look like you may end up having to either give them that incentive or, look at accommodating them. Can they work remotely? Can they work on a site off by themselves? Because right now we've still got the concern, hey, you could still get sick if you're not getting the vaccination. So you've got to consider those things as well when you're doing that somebody may have that reason. Now, you don't need to go to your employee and say, do you have a disability? Do you have a religious reason? Do you have disability? Do you have you wait until you know or should know, and that's through the grapevine. Hey, I heard this person saying they couldn't get it because they have a disability. Well, I'm on notice now. Now I can have a private conversation with them and inquire more into it. But you don't need to affirmatively go and ask them, do you have a disability? Do you have a religious reason? We typically do not want that information unless we have to receive it, right? The other thing to consider is that if you make that vaccination mandatory and they get sick from it, from complications, that it is going to be a potential work comp claim if they miss time from work, right? So just keep that in mind. If they have complications, that would be a workers' compensation claim. I know we haven't, we were very fearful of work comp having to cover COVID, but there actually has been very few cases where that work comp claim has been accepted and paid on. You figure for the most part, if you're working in ag, you're a pretty healthy individual. That's a tough job, right? We just haven't had a lot of people with severe complications that would require workers' compensation. Sick, certainly. Out from work for a few weeks, definitely, but not requiring workers' compensation coverage or additional care that we were overly concerned about. So that has been better than we thought. And certainly so far with the vaccinations, we've not seen anything that I personally have heard about that's been severe. One person had to, did have a pretty significant complication because they'd recently had COVID and did require a hospital visit afterwards. So that would be a workers' comp claim, right? So is that better or worse than your current situation? I don't know. It's something to watch out for. The other thing you want to consider is this going to cause a morale problem in my workforce if I say that it's mandatory? You've got people who are fearful. You've got people who are always going to be opposed to vaccinations, right? Can you even afford to leave those workers if they get mad and leave, or they just don't want to do it and they leave? We've got a worker shortage in agriculture. And so we might not want to do anything that causes a mass exodus of workers. They may be upset by the idea of you making it mandatory and leave for that reason because they've got other options right now, right? Lots of ag jobs available for folks who want it. The other thing that I want to mention to keep in mind is if you decide to do your vaccinations in-house, which most of us will not, remember when you're asking for that medical information, this is different than, hey, I came to work this morning. I asked them if they had symptoms of COVID. I took their temperature. That's easy. But when you go to get a vaccination, you may be asking for the pre-screening questions, maybe giving more information than we're used to. And that can implicate GINA, the Genetic Information Act. And so collecting that becomes a little bit riskier. You want to make sure you're taking no more information in than necessary. And then you have a risk, of course, if you collect that information and then you terminate with any reasonable time afterwards, they may look back and say, hey, you terminated me because I answered this way on that question. If they go offsite to get a vaccination, or they go through a third party, right? That third party collects that information, they keep it, we don't receive it. The only thing we want to get back if we're paying an incentive or keeping records of it is proof of a vaccination, which doesn't have any of that genetic information or medical information on it. And so don't take any more information than absolutely necessary for your purposes so that you don't run afoul of those issues. And lastly, make sure you're taking that medical information and you're sticking it into a medical file, not into their personnel file. Those files are kept separately by each individual and they're in a locked area. And with that, I will turn it back over to Kim for some Q&A.
All right, thank you so much, Erica. So this is definitely a lot of information. We're actually going to start with Supervisor Pedrosa, because I know his time's a little bit limited with us. So the biggest question, we've got a lot of different versions of this question in the chat, but as an elected official, how would you recommend that people try to get in contact with their elected officials? And what are some really actionable items that they can do? We see a lot of, I want the vaccine, it's important, it's important. How do they get in front of those people and really emphasize the prioritization to get results?
Thank you, Kimberly. And look, this is not about jumping the line, right? It's still playing within the 1B tier. I think what I would tell FLCs or anyone that's interested is reaching out to your county supervisors, identify which one is in your district or which one you have a relationship with, and engaging with them. Look, they have the same objective you do as well, which is to ensure that our ag community is getting vaccinated and that we're removing any barriers. So it's how do you work together to accomplish that same objective? So I think framing it that way, I think, is the first step. And then working with public health of saying, okay, what is the local strategy? How is that county prioritizing resources? Every county is different. Again, Napa County we created healthcare partnerships. There's also a lot of opportunity with federally insured health centers, community clinics that have a great opportunity to also reach our ag community. So again, it's identifying those community assets that exist in those communities. And that's where, again, call your supervisor, email them, offer to help. I think that's what I would say, Kimberly, is the first step. And I'm happy to help in any way I can. I answered some questions in the chat. I'm happy to facilitate an introduction as well. But I really think that is a really meaningful first step to ensure that, again, we're addressing those questions that we all have and to really understand what are the local prioritizations among each county.
So for the very first step, are we literally Googling supervisor in my county? What's our very first baby step to get them on the road?
Yeah, that's a really good point. So if you have not engaged with your county supervisor, go to the county website, identify those supervisors. It's the Board of Supervisors. You can identify, there's 5 of them there. If you haven't worked with any one of them, you can go to the chair of the board, which is identified on the county website, email them, and really, it doesn't need to be too long, but say, look, I'm a FLC. I'm interested in ensuring that our ag community is getting vaccinated. I'd like to understand how you're prioritizing this in our county and how I can be of help. Simple as that. I think that is the first step. I assure you, I would put a very high degree of confidence that most elected officials will respond to a statement that way. Now, I wouldn't, what I would caution you is, because we're getting a lot of frustrations and emotion expressed, right? But I would kind of turn it into a positive. How can you help? I think an email frame that way, I think, would be very well received.
I believe, forgive me if I'm misapplying Anne Marie, but as an example, is I believe that she actually had talked about potentially having a location that could be used as a vaccination site. So is that kind of what you're saying?
Well, no. So the problem is, vaccination sites isn't really the issue right now. I shouldn't say isn't really the issue. It's inventory shortage, right? So from a county perspective, we're being very mindful of going and creating new vaccination clinics because we don't want to create expectations that we're creating new clinics if the inventory is not there. Now, what we have done, and this is what we can find out, is identify what are the plans. Are we going to be identifying new clinics? Are we going to be putting a clinic where we know that there's a specific portion of our population where they live? Is there any healthcare partners that have mobile clinics where we can be taking a van? You can't do it with Pfizer because it requires different refrigeration, but the Moderna vaccine is easier to transport. So those are the questions that you can ask those supervisors. But again, what we want to be very careful with is saying that we're going to go create more vaccine clinics where you create false expectations because we truly don't have the inventory to prop up new clinics. Now, what the federal government is doing, they have strategic partnerships where they're creating mass vaccination sites throughout the state of California. That's from a different allocation than we're told. So again, right now, it's not about saying, I need a clinic here or I need this. It's understanding the strategies that those counties are implementing to reach our ag community. And once you know the strategy, that's where you can now provide input of saying, well, have you realized that maybe by working with us, we can work and coordinate and bring 200 employees, bring 100 employees, bring 50 employees. That's the value that you bring as an FLC, is you can coordinate. And that is in the best interest of the county because, again, we typically aren't structured to go reach communities at that scale. So I think that's what I see as the opportunity to work together.
Okay, excellent. I guess we have only a little bit more time with you, Supervisor. So this same kind of area, Anna Marie says that she has emailed the supervisor. What else can she do while she's waiting for that response? Maybe are they really Facebook outreach? How can you? I'm sure there's a lot of things vying for their attention. How can you?
Yeah. So a few things, right? If the supervisors are being non-responsive, the ag commissioner is another local resource in those counties, and also emailing, the public health team at the county. Those are all individuals that have a responsibility to respond. So again, ag commissioner, public health, you can, and then all that contact information is on the website. And then again, if all supervisors haven't been responsive, that's another thing. But if one in particular hasn't been responsive, reach out to the following. I think that's what I would recommend at the local level. There is also a California Association of County Governments, CSAC, and I'll provide that information as well. They've been doing some great work at the county level of bringing some advocacy. So that's another resource, more kind of statewide.
I always like the term polite persistence.
Exactly.
I'm not sure if you have any information on this, potentially some of the other panelists might. Do we know why there's such variation from county to county on the vaccination rates?
I know the state has tried to provide guidelines, and I don't want to speak for the state, but I do believe that's why they're going to my turn and also working with Blue Shield to maybe provide some more standardization around that. Again, this is not about jumping the line. It's about trying to do this in a way that's equitable. And again, we're trying to look at, yes, we need to vaccinate 75 plus. We haven't even started on 65 plus because we don't have the inventory. But we've also been working with our healthcare partners who are receiving their own allocation of working with our ag community because they can do it in a larger scale. So, that's why there's a lot of variations, but I do think the state is trying to address that.
All right, thank you. Excuse me. Thank you so much. We're going to shift a little bit to some of the other questions that we have here. Tomas, if you'd like to come on, there was a question which you did answer in the chat, but if you'd like to answer it for the group as a whole, what are the ID requirements? And in particular, what are some alternatives for people who might not have traditional IDs?
Yes, like I mentioned in my presentation, I think this question was asked. This is something that's coming up lately, and we're still working on trying to get a standard to get what works for a lot of people, but it varies from local health jurisdictions. But like I put in the chat, it does not have to be a government ID. They can use library card if they have one. Sometimes a matricula card, which a lot of Mexican nationals might have. Also, something with their name on it, like a bill, electricity bill, paycheck stubs if their employers are providing a letter, something with the name that matches with their name, so that there can be at least some level of identification. But we are trying to get down one that works for everybody, but also meets the local health jurisdictions guidelines.
Anybody else have any comments on that they've seen anything used? I don't want to limit us too much on who our presenters are talking here. Actually, Dr. Hack, is there anything for the testing end that they would need along these lines for identification?
All the identification is self-supplied, so whatever the individual wants to supply, name, birth date, and insurance information is really all they essentially need. Everything else is just informational questions about whether they have COVID symptoms, and if they want to provide more information about their employer, workplace, and other likely risks of exposure.
Excellent. So moving on, we have a lot of questions, I think primarily directed toward Erica, but again, if anybody, other presenters have information to share, please do hop on. So are we allowed to facilitate as an employer, as an FLC, by having our staff enroll our employees that want the vaccine?
So, well, you're of course allowed to. The question is, do you want to, right? At this point, if you're facilitating, it depends on what information you're required to gather to facilitate as to whether I would want you to. So I don't want you collecting medical information at this point. But if it was simply putting in their name and getting a time slot for them for an appointment, that might be different. But there may be pre-screening questions that we would then be creating, and gathering medical information for. Maybe it's just providing your employees a list of places that they can get vaccinated at, and that is currently accepting vaccination appointments for farm workers. That could be facilitating it, or bringing or making available a third party to them at a particular date and time, and getting a block of appointments, and then getting who wants to go to that.
So if they are considering making the vaccine mandatory for an employer, how do they define the vaccine administered by an employer? Would that be having a third-party mobile clinic on employer premises?
No, I think that would still be a third party, because that third party is going to handle gathering the information, doing the disclaimers, getting the waivers, monitoring them after they get it. That to me would still be a third party, even though you're bringing them on site.
And this one, I think you got a little bit into your presentation, but if you could expand on it, if we want to incentivize getting the vaccine and we're not providing the vaccine to them, what are the advised limits for that incentives due to tax, legal, et cetera?
So keep in mind that anything of value that you give to an employee is legally taxable. And I know a lot of us don't know or ignore that rule, but even if you're giving a $10 Starbucks card, it's technically taxable. You know, and I know we don't tend to do that, right? And so I don't have a limit for you before it becomes taxable. If it's a bonus, you know, if it's let's say you gave them $100 bill, that $100 bill has to be run through their payroll and taxes have to be paid on that. So it is all taxable. And the value of it is supposed to show up on their paycheck stub is my official legal answer.
I've heard of some employers instead saying, we're going to pay you the whole day and it's just a day to get vaccinated. Would you recommend that approach? Any considerations?
Yeah, I think it's great. I think you're going to, you know, get a lot of people who choose to do that for getting a day off of work. I mean, you know, everybody could use a break once in a while, right? So I think that's great. It's going to go on the paycheck stub. It's going to be considered a day worked, because for part of that time, I'm going to actually be going and getting my vaccination right. And the time to do that from person to person could vary greatly. My dad spent 4 hours. My mom was in and out in like 35 minutes. So you're going to get that variation depending on where they get it.
Excellent. We have a couple more minutes, so feel free to send in some questions in the Q&A. But I had a question for Dr. Hoover. I know there's been lots of talk about the 2 different vaccines, the Moderna and the Pfizer, but we've also heard about the third coming out, the Johnson & Johnson. Do you have any comments or info to share with us on those?
So the Johnson & Johnson vaccine is going to be considered by the FDA later this month. And subsequent to that, if it is approved, it will then be considered by the CDC's Advisory Committee on Immunization Practices, and then potentially recommendation will be made. So there's quite a process that, you know, again, you know, as part of this sort of vetting of the safety and efficacy data associated with the vaccine, there's quite a process there. But assuming that the vaccine makes it through the process, I think the special thing about the Johnson & Johnson vaccine is that it's 1 dose instead of 2 doses. That does provide, I think, certain advantages, especially when it's a challenge, you know, logistically or to receive vaccination. I think a single dose vaccine could really be helpful. So we are you know, eagerly awaiting the outcome of those, you know, the process to consider and potentially approve that vaccine.
Thank you. Tomas, I have seen personally quite a few resources about how to talk about vaccines, dispel myths, outreach for workers. I've seen a lot in English, but as you've mentioned, not everyone's speaking English, not everyone's even comfortable in Spanish necessarily. What are some resources that people can access that are in other languages to really communicate with these groups?
Yeah, in my presentation at the end, there was a link to our website for the Vaccinate All 58, and on there you will find some resources in Spanish and in other languages that can be easily printed out and shared to some of the workers. So I think that's where we should start, and we will continue updating some of that information, you know, as we continue to learn more of what information people need on the ground to feel comfortable with the vaccine.
Sorry, garbage truck, of course. Well, those were my questions that I had personally, so I'll give it another couple minutes here. If anyone has any additional questions they'd like to put to our panel, please use that Q&A. Erica, what kind of questions have you been getting from your clients that are out in the field as FLDs and growers?
So mostly it's been, what can I do to incentivize them? And that's the part that, of course, has been in the most flux, because at first we thought, oh yeah, giving them a bonus is no problem at all. And then some issues were raised with the wellness rules. So that's the biggest question I get, is can I incentivize? What can I do to incentivize? And can I make it mandatory? So, incentive, if you want to incentivize, it's giving them a bonus of a certain amount, giving them time off, giving them PTO, or giving them potentially a gift card, or, I don't particularly like the water bottle example, but, I don't think that's going to be super enticing to most people. But I think the other ideas certainly are incentivizing, giving them time off or PTO. We love that.
We had a question from Todd. He asks, if the vaccine is provided to the employees and then the employee feels sick, as they might, as Dr. Hoover discussed, and then they want to leave for the day, how would you record that? I think he's concerned that that might fall into the 3 cases of COVID would then, or excuse me, of coronavirus would then trigger that workers' comp. I might be misinterpreting that.
Yeah, it depends on if they just left that day and came back, it's not a problem, right? But if they miss more time, yeah, you might have a workplace injury claim, right? If you're making it mandatory. If you're not making it mandatory and you're just encouraging it and they get sick, then you can offer your California paid sick leave time off to anybody who needs it. And, give warning that it's really the second dose where you might want to take the day off when you get that. And I think that's one of the reasons why giving that day off of work is a good idea, in case they don't feel so hot that particular day, because, you'll get some mild symptoms, but nothing in comparison to getting it. So well worth it.
And then the illness they feel from getting vaccinated would not qualify as a case for coronavirus, which, yeah, forgive me, as I'm not the lawyer here.
So all that OSHA stuff that we always worry about, right? None of that is implicated. And that's the whole point of getting vaccinated. If I have to exclude people under the OSHA standards because they were in the same workplace and they potentially could have, been exposed during the infectious period, right? And I've got to pay those people to stay out for 2 weeks. That's a lot of time and money that may or may not be covered by the FFCRA, the federal act, right? So, paying somebody for a day is way cheaper than having to pay somebody to be out 2 weeks. Same thing with, $100 bonus. It's way cheaper. And even if you had to pay overtime on top of that bonus, still way cheaper than having to exclude people from the workplace, because I've had clients who've had to exclude workers multiple times. And it was always because somebody did something on the weekends, somebody went to a party, somebody went to a family gathering, and then brought it into the workplace, exposing others. And then we end up paying the price as employers by having to then exclude everybody who might have been infected. So on our dime, we don't have to pay the person who actually got sick, but we would have to pay those that were otherwise available to work.
Okay. Dr. Hoover, I think we might not have a good answer to this question, but do we know how long the current COVID-19 vaccine effects will last as far as protection?
So the person who asked this question said it might be too soon to know. And yes, it is too soon to know the answer to this question. So please stay tuned. And I think as we understand the longer term efficacy of the vaccines better, that will have a clear answer.
Could you speak to the concerns about the different variants and the efficacy of the current vaccines? I imagine a lot of that's still up in the air as well.
Yes, it is. It is. I think, though, that the fact that there are variants out there doesn't change the support that we have in the public health community for vaccination, and are really encouraging people to get vaccinated when they have the opportunity to do so.
All right, well, I'll take one more question here, just barely over time. Erica, should we use COVID pay for sick time post-vaccine or just regular sick time?
So if you're under FFCRA, you have to qualify to take the tax incentive. And so that wouldn't qualify under FFCRA because they aren't sick and seeking, experiencing symptoms and seeking a test or in quarantine. So those two reasons don't pop up. So to me, it goes to California paid sick leave or, 3 days of time that they could take that off for.
All right, well, thank you so much to all of our panelists for sharing your insights with us, as well as Supervisor Pedrosa, who had to hop off. As you might imagine, he is in high demand at the moment. And thank you to everybody for attending, whether you attended this in real time or you're watching the recording. We appreciate it and hope this was helpful.
Thanks, Ken.
Thank you. We'll catch you next time. Thanks, everyone.